He studied engineering in London on a Public Service Commission scholarship. And he went on to work in the Singapore Administrative Service for 10 years. Guess where he went to next? McDonald's. Yes, McDonald's. And he worked several years in McDonald's as the Director of Operations for Singapore. Today, he is the Chief Executive Officer of the Agency for Integrated Care, or AIC. But is this where his heart really is? That's what we're going to find out in the next 15 to 20 minutes. Tan Kwang Cheak, welcome to Inconvenient Questions.
Thank you, Visual.
And is it all right if I call you Casey?
Please do. Most people call me.
Wonderful, wonderful. Okay, now let me straight away get to the first question. Right now, Agency for Integrated Care (AIC) has been around for 11 years now, and I took the liberty of asking several people, that I know, have you heard of AIC? And a significant number of them said, no. What's AIC? Right? And those who have heard of AIC, they don't know what it does. So, to me, there are two possibilities. One is you're not doing a good job in informing the people about what you do. Number two, it really means that what you're doing hasn't had an impact. What is it, Casey?
So, if I can share, aging, I think, is really a longer-term challenge for Singapore. It requires actually many of us to come together to deal with it and to help our Singaporeans age with dignity and age well. AIC has been around for the last 11 years, and I do acknowledge that in the past, when we were set up, it was really intended not just as a response to aging, but also to help to manage services and program in the community, for Singaporeans, for our clients and seniors. And in the past, we have remained more in the background, working through our service providers as well as working through our partners and being able to support them through different programs, capacity building, capability building, so on and so forth. And so we were not quite in the forefront, I think, of public's awareness in the past. And so that has been, our mode of operation, in the past years. But that is changing this one. I think with the growing challenge of aging, with the growing need for us as well to help Singaporeans be aware that we are the one-stop, we are able to help provide information, provide referrals, provide support to both clients, seniors, and the caregivers.
So if I can ask you, right, I'm sure you'll agree with me, this is actually a challenge that a lot of government agencies in Singapore face. It's probably because you guys are civil servants. You don't like being in front of the camera. You don't like going out there because you feel that, your job is to get the job done and not to go and do PR. But you see, it comes with the job. If you are doing good work and relevant work and the public doesn't know what you're doing, then you're not doing a job.
Agree fully. So it goes to our mission and what we seek to achieve. And if the means for achieving that is also to increase awareness, people's understanding of what AIC do and know that they can come to us, when they need help, need support, need information. That's what AIC is seeking to do, which is why we are going, more in terms of public branding, in terms of awareness of AIC, our website, our hotline, and our touch points, and to be there actually to be the one-stop actually for the public when they need support and help for communities, care services, as well as for seniors.
Does this mean that even though the public may not be very aware of what you do, your immediate clients, the nursing homes and so on, are they well aware of what you do?
We work very closely with our partners and our service providers within the community care sector. That includes those providing home care, center-based care, residential care through the nursing home. But Visual, I think what I want to emphasize is the fact that we are increasing the public's awareness and understanding of AIC. And during the circuit breaker and COVID-19 period, actually we found that it's really important and useful for us to be the one-stop where the public, caregivers, family, seniors can call us for help. For example, if seniors need help with food delivery, with errands, with support in any way, we'll be in the forefront of helping them and coordinate care for them. That's what we've been doing. Over the
Wonderful. So in a nutshell, in 1 minute, could you just share for our viewers' benefit what AIC does? What's the value add?
AIC focuses on helping our Singaporeans live well and age with dignity within the community and at home where they are. And we do so by outreaching, engaging our seniors in the community. We help to provide them with assistance, support, information, and we work together with our partners in the community care sector to provide the care support services and programs for our seniors really to age well in the community. And that in brief is actually what we have been focusing on.
You also are very involved, particularly involved with the aging, with the elderly. Am I correct?
Yes, and that is particularly our focus in terms of understanding the needs of our seniors, because we have an outreach arm called the Silver Generation Office that outreach, they inform policies, but more importantly, they also help us to identify how our seniors are, where the needs would be, and then we are able to then match the needs of the seniors to the available services programs by our service provider in the community. So that actually has been a key focus and how we feel we're able to help Singaporeans live and age well and with dignity in the community.
So, so with the Silver Generation Office now as part of AIC, does it mean that the Pioneer Generation Package, Merdeka Package, all of this also comes under your administration, AIC's administration?
The function of informing government policies, as you mentioned, with regards to Merdeka Generation, Pioneer Generation packages, as well as, for example, CareShield Life, which is coming up, will be done through our outreach arm of our Silver Generation Office. But beyond that, given the merger that has happened back in April 2018, what the Silver Generation Office is also helping us to do is to be able to engage our seniors, identify again the needs proactively, and able to help to offer them services, programs ranging from active aging to befriending, to care and support proactively to our seniors at home and in the community.
Okay.
And that's where we feel that is the power of our ability actually to be able to understand and meet the needs of our seniors.
Okay. Now, it sounds to me like you've got a ton of responsibility on your shoulders, and I hope your shoulders are strong enough to take that kind of responsibility. But it also appears to me that you don't have sufficient resources. And if I can be blunt, I don't think you have enough resources. Now, this probably is the reason why the 2018 Lien Foundation report, a very seminal report, actually highlighted that even though the number of places in nursing homes and so on have doubled in the last decade, it is still far lagging behind the supply. Or rather, the supply is far lagging behind demand. Now, how are you going to cope with this?
This one, it goes back to my first point earlier, where I pointed out that aging is really a long-term challenge for Singapore nationally, and indeed, it's not only in Singapore but many countries. And this challenge actually requires a whole of government, whole of society respond to be able to help our Singaporeans age well here. And so it's not just AIC. AIC does have the full support of MOH as well as the ministries and agencies. And we are setting forth in terms of being the one-stop for seniors and to help them to age well. But this requires more than AIC. And it requires other agencies and ministries to work in partnership with us. That's something that we seek to do. But also together with our partners out in the communities. We have many good partners, service providers who are out in the community doing great work for the seniors.
I believe the Silver Generation Office has a lot of volunteers. Am I correct? Registered to support?
Silver Generation Office currently has over 3,000 volunteers.
Are they active volunteers or are they just names?
They are active volunteers. They are helping us to knock on the doors of our seniors, find out how they are, and help to feedback in terms of needs. And even during the circuit breaker phase 1, phase 2 period, they're also helping us to contact the seniors, largely through tele engagement, through using the phone, but making sure that we are able to follow up promptly, are able to meet their needs proactively.
Okay.
And so again, it's the case where it requires more than us.
In the area of affordability, now the individuals today want to sort of age at home. They don't want to age in a nursing home. That there's still the Asian taboo, perhaps. That you don't want your parents to be left in a nursing home. So you want to age at home. So nursing care at home and so on and so forth. What I understand is home care is significantly more expensive than a nursing care. right? So if you are in a nursing home, a VWO-run nursing home, I gather that your cost would be in the region of $2,400. Am I correct? Around there, $2,000 over dollars, and this is before subsidies and so on. But if you are home care, that means the nurses come home and all the treatment is at home, the price can go up to higher than $3,000 per month. So how is this going to be? How are we going to encourage more care at home if the price differential per month is so significant? What's being done?
Yeah, this one you're right in that if you do ask most of our seniors in terms of where they will want to age in, I think the preference will be to age at home where, they are with their loved ones, family, in the communities that they're familiar with. So that has been, a big part of our focus in terms of supporting them to age in the community. You are right in that there is differential in terms of the cost, say between home care as well as a nursing home sort of residential sort of care services. And this, I think, is largely primarily driven by the fact that it is a difference in terms of the model of delivering care, which then comes with different cost consideration. One part of it, if you think about the residential homes, is sort of dedicated facility with care staff there to look after the residents. But in a way, the residents are looked after in a group by the care staff, and there's some shared, cost.
It's not personalized. It's not one-on-one. Yeah.
Not a one-to-one. Home care by its nature is one-to-one. The nurse or the doctor or even the therapist will have to travel to the person's home and deliver the care, and therefore, the costs will indeed be higher. And so there is a differential in terms of the two different models, business models, as well as.
But what is being done to help defray the cost? It's very exorbitant.
Yeah, the government has, and the Ministry of Health has, put in different sort of layers of financial assistance to be able to help, I think, Singaporeans be able to afford these services. This ranges from means-tested subsidies, as you pointed out, which could extend to up to 80% of the cost of the services. It includes financial assistance and support, whether it's in terms of the home caregiving grant, or in terms of pioneer generation disability grant, so on and so forth, which, by the way, AIC administer as well. And the last part is really putting in place insurance to make sure that should any one of us becomes disabled or has some disability, the insurance payout will allow us to afford these services better.
Okay.
But I would say more needs to be done. I think financial cost is a consideration, is a key consideration for families. But beyond that, I think we should also consider other factors, including, the condition of our loved ones, including whether it's better for them to be cared for in the residential sort of home if they need more continuous care, whether the family and the caregivers are able to support them, and also preferences, as we mentioned.
So there needs to be a lot more discussion, a lot more education, perhaps, or socialization about these issues, because a lot of people at home, a lot of people who are providing care don't really know what these options are. We are running out of time, so I just want to go to another key question, which is, how do we care for the caregivers? I mean, the caregivers are struggling, and I gather that there are 210,000 caregivers in Singapore, and I gather that many of these caregivers are themselves elderly, and there's one particular study that said that 40% of the caregivers of stroke patients are in need of mental depression. They've got depression and need help. So how are we tackling this? Very quickly, please.
Yeah, caregivers is a critical part. I think they play a critical role in supporting our loved ones' care journey, and we really need to do more to support them. I think we've rolled out different programs to support our caregivers, and this is through the caregiver support package that MOH rolled out in 2018. I think just to point out, one aspect of it is not just access to information or financial support, but like you mentioned, it's about supporting their emotional and social well-being. And how do we do that in terms of? So we are doing this in a couple of ways. In terms of working with our partners, for example, Caregiver Alliance, to roll out caregiver support networks and programs to support our caregivers. That's one. Two is really.
So when you say support, are we talking about respite?
We are talking about activities to help them to, balance the demands of the caregiver. We're talking about access to support networks, perhaps other caregivers that can, give them peer support. We are also talking, like you said, about respite services. So respite services is a key part as well to support our caregivers, give them a break, I think, from the demands of caregiving. And here we are also doing more. We are committed to do more.
So can you give an example very quickly about respite care?
No problem.
Respite service.
Respite services, we have been rolling out weekend respite services as well as longer term respite services together with our partners. But two, I think, relatively newer initiative. One is what we call the Go Respite program, which helps caregivers and their families pre-enroll their seniors for respite services at our partner service provider, so that if they do need the respite services, they can activate it at very short notice, but then they have to go through a process where they go through checks, X-ray, and so on and so forth. The second, pilot that we're running that we are fully committed to see through is really the night respite service, support services for caregivers of persons with dementia, and who may show behavioral or sleep issues at night, which is particularly demanding for caregivers. And with our partners, we hope to offer that. And now we have 4 partners on board to be able to give respite to caregivers during certain nights, and they can have a good night's rest. So that has been good feedback about.
Okay. So Casey, we've got another minute left. In fact, we are overrunning, but I'm prepared to give you another minute. So I'd like to wrap by saying you've highlighted, in this short conversation, we've highlighted several issues, right? And they appear to be insurmountable issues, and they are here, and these issues will only get bigger as the years go by, right? Because society is aging so fast. Now, what are your final comments about this? How are we going to tackle this? As a CEO of AIC, is your heart and soul in it? Are you putting enough pressure on the rest of government to say, let's go? Are you the champion that we are counting on?
I believe very strongly, I think, AIC's mission and purpose. And you're absolutely right. Aging is a key issue facing Singapore, going forward. It requires a whole society effort to actually be able to help create Singapore as one of the best places to age in. And, I strongly believe, and I feel privileged to, be able to be involved and help lead some of the efforts, these efforts to be able to, help our Singaporeans age with dignity. And I feel beyond that, it's not just about helping Singaporeans age, gracefully with dignity. It is also about our efforts to change, I feel, the mindset and narrative on aging. That Singaporeans need not be concerned, fearful, or feel that aging is something to be so concerned about. It should be a case they feel assured, they feel supported, that indeed they can age well, with dignity, and gracefully in Singapore. And I think that's what we are all working really hard towards. And we'd like to call upon all those who are like-minded to join us.
So can we count on you, Casey? Can we count on you and your team? Seriously.
Count on me and the AIC to be committed, to be fully committed to drive this, going forward for Singaporeans.
Well, Casey Tan, thank you very much for joining us on Inconvenient Questions. Wishing you all the best.
Thank you so much.
Thank you.